Begins the pregnancy lectures. This is part one. In this lecture, we will talk about some basic definitions and about what happens in maternal physiology. And also we'll begin discussion on maternal nutrition. In this particular lecture, we will talk about energy balance. So we begin with definitions. The timeline for pregnancy. We've already talked about this, how menstruation happens, and then about 14 weeks after a period is done, people can conceive. We've given that a little bit of information. And if they do conceive, this is kind of how the clock goes. Okay, so we have some terms here. We have trimesters, which everybody's used to talking about. We have the infancy period between 0 birth and 12 months. And so this is periconceptual, which means around conception. So you will often go into a doctor if you think you're pregnant or tried a pregnancy test. And they'll ask you, when is your last menstrual period? And then they'll determine then about how far along you are in a pregnancy. And then they will do measurements periodically to see if it agrees with this particular timeline, because there's a size difference that occurs here in the timeline. So just the language here, these are trimesters. Preterm is less than 37 weeks. Very preterm is less than 34 weeks. And I have these on the next slide as well. Term is around 40 weeks, give or take. We use the language embryo till about 8 weeks. And then we use the language fetus until birth. And then we say neonate or baby. But during development here, it's either an embryo or a fetus prior to birth. Those are the appropriate language. Unfortunately, many people experience spontaneous abortions or miscarriage during the first 1 or 2 trimesters. It can happen to about 20 weeks. Sometimes between 20 and 40 weeks, they may not have aborted, but they find out during this time that there are permanent damage, depending on the kind of tests they get done, they find out about permanent damage during this particular time. People can experience fetal death or stillbirth during the 2nd and 3rd trimester. I won't focus on this anymore. I just want you to have a timetable to take a look. So here's your terms. Preterm, I told you this is the slide that has the actual definitions that help you study from. Preterm is born prior to the 37th week. Preterm babies have a few more problems depending on how early they're born. They may have to deal with immature lungs. They may have to be in a neonatal intensive care unit for that. They may be small. They may have to be fed in a different way. This is a medical nutrition therapy approach. So we're just giving you the definition here, and our focus in lifespan is on health, healthy babies, not ones that have medical issues. Term, as we talked about, a zygote, that term just has to do with the first cell that's formed when the sperm and egg fuse. Okay, when the fusion of 2 haploid gametes, a gamete is like a sperm or an egg. When they fuse, a zygote, it's a fertilized ovum. As soon as it starts splitting, then it's called an embryo. So that first cell is a zygote. Embryo extends from 2 to 8 weeks. We have multiple cell divisions going on. At some time during that point, they're going to implant into the uterus. The word fetus starts at around 8 weeks, and then so on. So neonatal is 4 weeks after birth. So we've talked about this. So these are the different, this is the trajectory of size. So the next section we're going to talk about is maternal physiology. And I have the 2 things I want to talk about here, anabolic and catabolic. And I know you've heard these terms before, but let's review them. So in this case, your book does this, and I really like the way they do it. So I adopt their approach to it. So maternal physiology, we always talk about trimesters, 1st, 2nd, and 3rd. But with respect to her physiology, you can kind of divide the pregnancy in half. Whereas the first half, about the growth of the fetus is very small. Okay, it's just a little tiny thing, right? And during that time, her body is gearing up for a pregnancy. That's why it's called anabolic. Anabolism means building, right? Catabolism is breaking down tissues, anabolism is building. So during the first half of pregnancy, her tissues are growing and she's developing a placenta. You can see the placenta here. This is the organ that connects mom's blood supply indirectly with the fetus. So this is the primary organ that supports that pregnancy. So during the first half of pregnancy, her tissues are growing, several of them are growing, breast tissue, uterine tissue, circulation and so forth. And she's also developing a nice placenta. During this time of growth, her total body, this is very interesting, so hang on to this. Her total body water increases from a normal of 70 liters to 10. So part of that weight gain is you're just hanging on to more fluid. Don't fight weight gain unless it's due to overconsumption of food. Okay, so body water increases during this first half, and she's making more blood because she needs increased circulation for her heart function and also for the placenta. And amniotic fluid is in the sac that surrounds the infant. The fetus is in a bag of waters. You may have heard that term before, and that fluid is in there. You don't see much here, but when they're smaller, there's more. And then also she's got extracellular fluid, and sometimes she can even have edema where she gets swollen. So mom becomes more aquatic, okay? And this is what's interesting right here that will help you explain to people why they're tired. And I'd like to ask this question on a test. First, what happens first is her body water increases. So she's wetter, but she has not been able to keep up with the production of red blood cells. Because remember, it takes a couple, 3 months to grow red blood cells and to replace them. And so right at first, what happens is she has this increased fluid, but her blood is more diluted. It doesn't have as many red blood cells per volume because she's upped her water in her body, but not the number of red blood cells. So how does that make her feel? It makes her tired. So, and if she was an exerciser, all of a sudden she may go, I just don't have to walk up the stairs. It's really too hard. What's happening is she doesn't have enough red blood cells to manage her normal physical activity level. So they're tired at first, usually up to about half or about 4 months. Women often get really tired. They can still exercise, and we'll talk about that, but this is how, it's nice to be able to explain to people why they don't feel good and that it's going to get better. Okay, so this is total body water. So her tissues change. Now here's why. In pregnancy, insulin levels go up. If the insulin levels are higher, it's a normal function of pregnancy. Insulin, and I know you remember a little bit about what it does. Insulin is required for cells such as skeletal muscle cells and fat cells to allow glucose to enter. That's what insulin does. Remember, so people that are diabetic, the insulin doesn't work, or they don't produce enough, and they have high blood sugar. But in normal health, insulin, you eat a meal containing carbohydrates, glucose gets into your blood, your pancreas produces insulin, insulin goes up and causes your cells to bring in that glucose. It's how we maintain normal blood glucose levels. So that's what insulin does. In pregnancy, it changes. Pregnancy, instead of normal insulin levels, insulin goes up. And that increases lipogenesis and glycogenesis. What do those mean? What does lipogenesis mean?
Creating fatty acids.
Say what?
Creating fatty acids.
Yeah, creating fat, right. Actually, absolutely. Fat synthesis, lipogenesis. Lipo refers to lipid, genesis refers to making de novo. So your body makes more fat. So she's Elevated insulin makes her store more fat. What is glycogenesis?
Creating glycogen?
Beautiful. Actually, yes. Yeah, I left out gluconeogenesis, but glycogenesis, yes. So let's say mom eats, a piece of cake, and she should be perfect. So some sources, refried beans. Okay, so she gets this higher level of blood sugar. So what do you want to do with that? Well, the body, you want to burn it, or the body can store it as fat, or the body can store it as carbohydrate, like in the liver and muscles. So glycogenesis is taking the extra glucose and making glycogen stores. So her body is ready to grow another person. That's what's going on. She's increasing her body mass and so forth so she can grow another person.
Somebody in the chat had a question if you said that you replenish red blood cells every 3 months.
Let me back up to that. So I remember saying that what happens is, I want to look it up again, but about every 3 months, our red blood cells turn over. So we're constantly making red blood cells. So if we're anemic, it takes us a while to catch up to make them. So that's what I was referring to. So it takes a while. If you have a hormone that says make red blood cells, it takes a while to make enough to make a difference. Okay, the last thing is she makes, and this is critical, you guys don't lose track of this. So her total body water goes up, her tissues expand, and she develops a placenta that's going to be completely integral to supporting this pregnancy. So here's a placenta. Here's my placenta slide. So here's one so you can see what it looks like. This baby was just born, and the baby was born, and instead of cutting the umbilical cord, they had the whole baby be born. And so here you can see what the umbilical cord looks like, and then you can see what the placenta looks like. Okay, so it's interesting because when babies are born, so usually what happens is they cut the cord, and then mom sits there and she gets to give birth to this, which is not all that fun. But this is important, so they take a look at it to make sure that it's still healthy. The placenta is, again, the direct connection between mom and the fetus. And so it's the health of the placenta is a big deal. So here's showing you a sort of a diagram here of the placenta, but let's look at this whole picture because this is very helpful. Well, the picture's on the next slide. So a placenta is a brand new organ. It's only there to support a pregnancy. It goes away after the pregnancy. It serves as a barrier to harmful pathogens. So in many cases, mom can have a disease that doesn't get transferred to something else. For example, HIV. In the absence of bleeding, HIV, mom can be HIV positive and the fetus will not be. So it can serve as a barrier, not to everything. It fights infections, provides nutrients and oxygen. So mom's diet, is the benefits of her diet are crossed over, and oxygen. It removes waste products from the fetus, CO2, urea, and all those things that metabolism produces. And it secretes hormones. The hormones are there's several, but the 3 ones that we're going to focus on are progesterone, estrogen, and human chorionic gonadotropin. So I have some terms here at the bottom that I thought you might be interested in. What does the word placenta mean? Well, I think it's Greek for the word cake. And, I think that comes from the fact that this is supposed to look like a cake. So you guys may be better cooks than I am, but anyway, that's where that term came from. Another thing I want to bring up is placentophagy, because sometimes students are interested in this. There is a popular, or maybe not super popular, but there's a movement in which people think, well, let's save my placenta. I want to keep it. I'll put it in the freezer and eat it later, or I'll have it dry, desiccated and turned into pills and take those later. And so there's been this mantra of saving the placenta as if it had magical health promoting powers. My understanding is that it does not, and there's actually been some negative effects of people taking dried placental pills. This is not a nutrition topic, so I'm not going to go off on this. I just thought I'd bring it up. But some people eat their placentas, just in case. It's time for lunch, so if you guys want to think about it that way. Okay, one more thing about the placenta is, I'm going to show you in the next slide, but here's the fetal blood, and maternal blood pools around this. They don't actually mix. The placenta is actually a barrier between the maternal blood supply and the fetal circulation. So this is a cross section, so stay with me on this. So this thing is the placenta. Here's that umbilical cord we looked at. You can see the blood vessels in here. Now look at this. So this is coming from the fetus. See how these blood vessels, they're like tiny capillaries now, branch out into this placenta. Okay, so they're looking for getting all the oxygen, all the nutrients, and getting rid of all the waste products through this interface. Now, maternal blood is in here. It's the dark blue part, or the whatever color that is, baby blue. This is maternal blood. In the placenta, maternal blood pools around the ending of these blood vessels. What they don't do is mix. So the placenta is not like a big mixing bowl where the fetal blood comes in and her blood comes in, and you mix it up and everything goes in a different direction. It doesn't work that way. There is actually a specific transport mechanism that occurs. So here's the fetal blood circulation with a membrane of the placenta between maternal blood and fetal circulation. So this is a membrane of the placenta. These are membranes. And what they do is allow the right nutrients to come across and the right waste products to come across. So what this means is the blood of mom is not mixed like in a big bowl with the blood of the fetus. They stay separate. Okay, so this is how she can actually be HIV positive, and without bleeding here or a blood exchange, the infant can be born as a non-HIV positive. So the placenta has been studied a whole lot because it's such an interesting interface between mom and the fetus. The placental hormones that I mentioned, and you've already heard of these before, there's progesterone, estrogen, and human chorionic gonadotropin. Okay, these hormones are the primary hormones. Both of these help promote breast growth and growth of the uterus and affect circulation, so that her physiology changes a lot during this pregnancy to provide for this organism that she's growing. And then you've heard of human chorionic gonadotropin in the beginning, and I don't know that you remember this, but this is formed from the very first, when the placenta is just getting started, from fetal cells of fetal origin or embryonic origin. There is production of human chorionic gonadotropin. This compound is uniquely produced during pregnancy and is the basis of a pregnancy test. So if someone first urine in the morning, they have a pregnancy test and they put urine on the test. If HCG is present, that's a positive test. So that means that pregnancy has occurred. So this hormone you've learned about before, I just wanted to bring it up. What it also does is, remember, it's a placental hormone. It helps also grow the endometrium, which is the uterus, and it maintains the corpus luteum. Do y'all know what that is?
Wasn't that the follicle after the egg released? I couldn't remember.
No, that's a good answer. If you go back to your lectures on the or the slides on the ovary, the ovary has a follicle. Sometimes when it's time for ovulation to occur, the follicle ruptures. The cells that remain behind, if pregnancy occurs, then they become an organ that produces hormones. Okay, so I'm going to stop here. The rest of this lecture is pretty a lot less heavy than this one. I want to remind you that a week from, I want to remind you two things. Monday, there's some input for you that is due from the video project. There's 2 or 3 things due. They are not difficult or time consuming. Don't wait till Monday morning. Work on these. Go ahead and get those assignments done. This is, I don't want to say free points, but it's kind of free points if you just do it on time. So please take a look at the video, what's due for the video project, and be sure you take a look at that. And then the reminder is exam 2 is next Wednesday. So I will finish up anything that's going to be on that test either before class on Monday and write you about it, or be ready for that. So I'll finish up any study guides that apply to prior to pregnancy. So you have everything you need to study starting now. Any questions?
I had a question that was just a curiosity about what you think the next like supplementation or fortification is of food, because for a while they fortified omega-3s and folate. Do you think that there's going to be a next nutrient that they're going to try to incorporate into our diet?
Man, I don't know. You know, it was funny because I was thinking about that when I was thinking about talking about choline with you guys, and because choline is, you know, not an official nutrient, but a lot of people don't consume enough, and so we decided to add folic acid to, you know, flour because our diets are so bad. So I don't know, but I don't know of anything coming down the pike. I don't know. Thank you for your questions. All right, you guys. I guess you're all popping off. I will see you on Monday, and we'll probably communicate between now and then via our announcement world. Take care. Bye.
Thank you.
Thank you.